Hello, this is my posture and movement practical assignment. Do I have your permission to record you for my therapeutic intervention suit class?
Yes, ma'am.
Okay, perfect. So this is Samantha. She is a D2 basketball player. She reports to me, oh, she's also a freshman. She reports to me with chronic ankle soreness. So obviously I'm going to walk through my eval or whatever. So when I get to the postural and movement assessment, what am I looking for? So first I'm going to have her stand in a position that I can see all structures from. So all anterior, posterior, lateral and medial structures, and I'm basically looking for any asymmetries in the shoulders, hips, knees, ankles. And then for the movements, I can have her do a couple things. So I can have her do a overhead squat. So just quickly run through overhead squat. So when she's squatting down, I'm looking at her knees specifically to see if they're going in valgus, and I'm also looking at her ankles to see if they go in as well, or if they like overly pronate or supinate. And then I can also have her do a single leg squat, and I should really be able to see the muscle weakness in her left ankle. But again, I could see if her knees are going inward or anything like that. What will assessing posture and movement tell you as a clinician? So this will help me see if this is coming from muscle weakness or like any bone deformity, and it also will help me see if any other joints are being affected by this current injury. What impact does her chronic ankle instability have on short and long-term health? So for short term, she obviously has a risk for injuring that ankle. She also will have reduced performance, and she could also have reduced confidence just because of the pain and just her inability to perform at her highest capability. And then also just like difficulty performing sport-related activities or like sport-specific movements. So like jumping, cutting, things that like most basketball players have to do. And then for long-term, it'll have an increased risk of possible surgical intervention, or she's also at a high risk for osteoarthritis. What modalities would you use to help with this condition? So post activity, we could have her put her ankle in a ice bath for 15-20 minutes just to help with like the pain and also the inflammation that might be there. We could also put ultrasound on her ankle to help with any deep tissue inflammation. I would do that for probably 5 minutes, 2 to 3 times a week. And then we could also like give her moist heat packs to take home to put on there. Or she could get possibly a TENS unit, because the TENS unit will also help with like the pain. And then how can you help the patient reduce the risk of this happening again? So since she's having problems with plantar flexion and dorsiflexion, I can provide her with a band so she can do resisted band workouts to really help with that plantar flexion and dorsiflexion. She can also do the ABCs with her ankle to help restore that range of motion. What else can we do? Again, with the dynamic single leg exercises, we could have her do that too, just to help build up that muscle weakness that she has in her left ankle and leg. We could also provide better footwear and also make sure that she either has a brace or her ankle is taped before any activity. What medication would you recommend this individual taking for this condition, if appropriate, and why? So I would probably recommend Tylenol for the pain management, just because it doesn't have that much of a bad effect on her long-term wise. And Tylenol is very accessible, and since it's such a common drug, I'm sure she's already familiar with it. What are some considerations that athletic trainer needs to be aware of when recommending medication to this individual? So since HEs aren't allowed to give out medications, I could still educate her on the medications I think she should take and avoid. So again, I would recommend Tylenol, probably like 200 milligrams twice a day. One that I would really have her steer away from is aspirin. Aspirin is the #1 used medication for pain, but it does have more negative side effects than other medications out there. It could be harmful for like your gastrointestinals, and it could also cause like bleeding issues long-term wise. And then, is there a patient-reported outcome measure you would use to measure the progress of the patient, and what tool would you use? I would probably use the STAR excursion balance test, just so we're able to assess her progress over time. But yeah, I think that's everything. Sorry, I tried to get under 5 minutes, but it's kind of hard.